You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you are considering any type of cosmetic dentistry. If you are unhappy with your smile, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Art Mowry. Dr. Mowry is the founder of Exceptional Dentistry in Gainesville, Florida. We've invited him on the program today to discuss what's new in cosmetic dentistry. Dr. Mowry, welcome to the program.
Randy, please call me Art.
All right. Now, you're a pretty casual guy. You said you don't have to call me doctor. Call me Art. Is that what your patients call you?
I don't think there's not too many times that I've actually gone and probably introduced myself to doctor, and it's kind of funny, I guess, even hearing you say it. I don't know. We're just, I'm a pretty casual guy, and
all right.
We just, I'm just a guy that enjoys what I do, and not really into the whole, doctor thing.
But you say it's common in your practice. You wear flip-flops, things like that. Is that right?
I get that's probably pushing it a little bit. But,
okay, that's pushing it a little bit.
There's times maybe depending on what I'm doing. You'll probably see me running around there and maybe jeans, flip flops. If I'm not, really probably having to treat patients, and we do that just because, for me, honestly, it's just more about being, relaxed.
Because people don't like going to the dentist. There's no doubt about that.
Well, I mean,
is that true? I mean, you find that
unless they come see us.
Unless they see you, they like going to the
dentist. Absolutely.
Now, before we get into today's topic, and you brought a lot of photos, so we'll show those.
Cool.
Tell me a little bit about your practice. What kind of patients are you seeing there? Because you work with your wife, is that right?
That's correct.
Kim.
Yep.
Okay.
Well, Randy, I mean, we attract patients from, for probably really extensive reconstructive kind of stuff, from really all over the country. Occasionally come and see us. We treat a lot of other doctors.
Okay.
But on the same thing, the misconception maybe about our practice is that that's all we do is cosmetics and everything else. We're honestly, for anybody at all that's really just looking for, high quality dental care with a personalized touch.
You say Exceptional Dentistry, that's the name of your practice. Is it really exceptional?
We think so. Well, okay, let me rephrase that. I know that it is,
right.
Actually. Yeah, we have a great time doing what we do. We really pride ourselves on being on the cutting edge and just, just letting people know that if there's something special they were looking for, we can probably accommodate them.
Anticipating this interview, I feel like I could spot veneers 20 yards away.
Absolutely.
They seem big and bulky.
Yeah, and
phony.
And it seems like sometimes, and the more knowledge you have, like you, I mean, when you're, just learning a lot more about healthcare, then you get to where you're really spotting them a lot.
You say, I couldn't see yours walking down the street.
Sweet.
Is that right?
Yeah, absolutely. No, there's no way. Absolutely
okay.
No way. If you can see mine coming down the street, then I'd probably redo it.
You would redo it. All right.
I have way too much pride in my work to do anything that doesn't look natural. We're not into our practice. What we're known for is it doesn't matter what it is. If it's a back tooth, that no one else will see, but we will. You know what? We want to make sure it looks natural, and that's the key to it. We're not into the perfect smile.
How much is art and how much is science? I mean, you teach this stuff.
Well,
some guys have an eye for this.
Absolutely.
Some don't.
Oh, without a doubt. The science stuff's the easy part. As dentists, everybody's a scientist, for the most part. And really, I mean, when it comes to the technical aspect, we've got some absolutely in our area, and you meet a lot of dentists too. They're absolutely phenomenal technical dentists. Okay, I mean, do this, place this here. But what makes a smile, and when you're talking just really natural looking stuff, again, people go in and they go, I want a perfect smile. I said, then go somewhere else. I don't do perfect
You say
smiles.
that.
I do natural smiles. Yeah.
All right. You want
if
natural.
you want it to look, like you had your teeth, look, you can probably save a lot of money, and anybody can kind of do that.
So a patient watching this, what should they look for in a cosmetic dentistry? I mean, do they always look at the before and afters?
Well, I think they should. There's so many people, they walk in and, here, do this, and they think, some of them,
because nowadays everybody calls themselves a cosmetic dentist.
Everybody does, and some people think, hey, a dentist is a dentist,
No.
And that's the furthest thing from it. And I'd say, is a hairstylist a hairstylist? Because,
Do you ask them this is your focus?
Oh, without a doubt.
Well,
I think they should. You want to check training. You want to see pictures of cases that dentist has done, not representations. That's the key. I want to see stuff that they've actually done. And let me tell you, one of the first things I do, and I don't care if you're going into a plastic surgeon else, I look at the doctor. I'd look at their team.
All right.
No, I mean,
So they have to have good teeth.
Absolutely.
I'm guessing.
Absolutely.
And the staff also has to have great teeth.
Yeah, we like the word team because I really work with a great team. Randy, listen to me.
Everybody comes on the show and says they have a great staff.
Well, they might have a staff. I have a team.
Okay.
Yeah, I mean, the people I have, they're absolutely awesome. They look great. We have great smiles. Randy, walking in and seeing, imagine going in and the teeth are the dentist or their team. What message is it sending?
Do you tell that to dentists that attend your?
Absolutely.
Do you see it?
You know what I tell the dentists when I teach? I was teaching a course in Las Vegas 2 days ago. And I told him, I said, it's like having a fat aerobics teacher, Randy.
Yeah.
It just sends the wrong. It's like, okay, this isn't working or anything else like that. So, we're proud.
So walk in your talk. That's good.
Absolutely.
Now your wife, she has great teeth too.
She's got a hot smile. Absolutely.
All right.
Yeah.
Okay. Let's take a look at some of these photos.
Well, Randy, this is like a typical case right here. We saw Grace. Grace came in, and she's one of those people that. Now she's got a great personality as it is.
It's a good smile too.
Yeah, she's absolutely amazing. But what happened was there was just a lot of stuff that there's a lot of patchwork dentistry had been done, and that's just kind of what she thought. Coming in, it wasn't. We were able to do.
She didn't like her smile.
Yeah, and just didn't like it, and just kind of came in and said, hey, what are some of the options we can do? And then we turn around and we replace the old dentistry, get rid of a lot of the metal stuff in there. For the most part, honestly, probably about 90% of the restorations we place have no metal in them, and that's how we get that translucency. We make the stuff look great, but it's not as simple as just going to a dentist and say, oh, don't put the metal in, because that material, when you take the metal out, this becomes extremely, extremely technique sensitive.
So what'd you do for her?
Went in, took out the old dentistry, and basically just went in there and reconstructed her bite with porcelain. So it's fantastic, yeah. So, you take that, and then she ends up coming around, she looks like that.
It's beautiful.
And the neat thing with that, Randy, that took us, I think her case took us 3 visits to finish that, and a matter of 3 or 4 weeks.
So she's younger as well.
Done. Oh yeah, and you know what? You take this lady, and she come in. She's so beautiful. She's got just a great heart, but she's hot. It's great. And I love telling her. She's one of my favorite people. I love seeing her when she comes in.
You see changes in their personality.
Oh yeah,
just by changing their teeth.
Absolutely. Well, we see it.
It sounds like an overstatement, by the way.
Oh no, think about. In any relationship whatsoever, don't we all want to be around people that smile more?
How much say-so do they have in the final result? Because it seems like the fear would be,
Randy, we give them no say-so whatsoever. If I want to give them a gold grill, that's what they get. So, no, absolutely. What ends up happening is we like to always just sit down. We spend a lot of time talking in our practice, and whether you realize it or not, Randy, I actually like to talk a lot. So anyway, what we end up doing is we like to get in, we like to get to know everybody. And when we're getting to know them, we get to start to feel for what their personality is, because it drives me nuts. I have people come in all the time that are, I had my teeth done, it just doesn't look right. And there's a lot of times that I can actually get in there and just reshape the teeth and make them happy, just by being able to reshape and make it more than, because you know what? Everybody's teeth it's not a one size fits all.
Is there a lot of that going on?
Yeah, unfortunately, especially with some of these.
But you think the teeth are pretty important. Of course you're going to think that. You're a dentist.
Absolutely. Well, that's what I went to school for, so it works out good. And so that's what we kind of look at the whole time.
All right.
But no, you have to go in there when you're doing that and really kind of customize the smile. And that's why when we see some of these things out there, I think the biggest cases that I see, the biggest mistakes I guess I see that are being done for people's smiles would be the overuse of some of these. I think you've seen some of these types of veneers and things out there where they say, oh, you can come in, you don't have to even work on the teeth, and you don't have to even get the shots or anything else like that, and you're gonna have a great smile. Well, it just
sounds good though.
Very, very few. There are absolutely, that would be great. If we could,
just put porcelains over there, over their current teeth.
Yeah, but
so what's wrong with it?
Well, just think about it. It's going to be big, bulky. And you're going to tend to get that one piecey look.
Interesting.
And unfortunately, it's probably not going to hold up.
One piecey. What do you mean one piecey?
Well, you ever seen those ones where somebody comes in and they go, oh man, I had my teeth done or I had my veneers done, and it's like they're like one straight.
Looks like
thing,
a denture.
It looks like just one tooth. Looks like a denture. Exactly. And that's a neat thing. Like when I go in, even when I'm having to maybe replace somebody's dentures, it has those. We love doing those because you know what? It's a chance to do the same thing, to put our artistry into recontouring the teeth and putting all the spaces in, and really going in and putting little edges and chips. Same thing with my teeth. You know, it's not that one piecey thing.
It gets almost smaller at the edges.
Yeah.
Very nice.
So as good as my artists are, my ceramic artists, there's not a case that doesn't come back that we don't see over the next week or so, and they're not and we'll come in and we get fresh eyes. We try not to do it at the same time, and we get in there and just kind of tweak it out a little bit and
make it just perfect.
I saw one the other day. You know, patient came in 6 months later and they're just in get their teeth cleaned, and I'm like, yeah, you got to come over and get the chair because I see something I want to change out. Just
are you a perfectionist when it comes to this?
You know, I